This video is the first of 2 videos explaining the ongoing treatment of wounds with Amikapsul until wound closure is achieved. When a wound refuses to heal, it's because of infection. A wound is like an iceberg. The visible part of the wound is like the tip of the iceberg. The huge and really dangerous part of the wound is the infection lodged in the tissue underneath the opening, out of sight. This is where the infection lives, thrives, and spreads in all directions, downwards, diagonally, and to the sides. The older the wound, the further it will have spread. There are 3 main steps to complete in order to achieve closure of a wound. The infection must be removed. The lost tissue must be restored, and the area must be covered with new skin. Amikapsul helps your body's immune system perform all 3 tasks at the same time: draw out the infection, restore lost tissue, grow new skin. This video is intended to explain how you can best support the use of Amikapsul at the different stages of the healing process. When starting to use Amikapsul, lots of old debris from the infection in the deeper tissue will be drawn to the wound surface as discharge or exudate. Also, old dried-out debris and dead tissue lodged in the wound opening will be loosened a little more each day and be ready to be removed. Underneath this discharge, new tissue and new skin will appear, often in a budding way. This should not be damaged. Discharge is continuously drawn out. All discharge as well as old and dead tissue must be removed daily while taking care not to harm new tissue. There is consequently a balancing act between ensuring all debris is properly removed while avoiding damage to the new tissue being created. Showering with tap water is the best way of making the distinction between what needs to be removed and what needs to remain. Discharge and old debris are referred to as slough. The slough found on a wound surface can be any colour, ranging from white over yellow, red, and green to brown. And it can be any texture, ranging from watery over creamy and viscous or thick to dry. For the first days, this can make the wound seem messy when the dressing is removed. This is normal. It will look good after washing. The amount of slough will reduce daily. In wounds with severe infection, initially there can be days with a sudden heavy discharge. This can be of any colour or texture. Slough must be washed off every day. When wound debris and exudate are not properly removed, it may dry out over time and turn into a leathery substance. Eventually, it can turn black and hard into what is called eschar. Infection will always be thriving underneath eschar, and eschar must be removed as soon as possible. Eschar should not be mistaken for good and healthy scab, which will often form in the late stages of wound healing. Independently of amicapsol, the use of antibiotics will often keep the slough intertwined within the tissue, and it may even dry out or stiffen the slough, making it almost impossible to remove. Amicapsol will work if you need to take antibiotics for an unrelated condition, but the healing is quicker without antibiotics. In new wounds, you should experience a reduction in pain and in the amount of discharge soon after you start treating your wound with amicapsol. This should continue to reduce over time. In old wounds, the pain will reduce rapidly. The amount of debris, and therefore discharge, drawn out and ready to be removed from the wound surface can be high during the first days. This will rapidly reduce in quantity. In extremely old wounds, the pain can increase during the first days of treatment. The discharge is likely to continue for a little longer than in younger wounds. Both pain and discharge will gradually reduce. You already know your 3 friends from our video, How to Use Amicapsol Wound Treatment on the First Day. These are amicapsol, tap water, and air. As you know, never use any type of antibacterial, antiviral, antifungal, or otherwise antimicrobial disinfectants, irrigation solutions, wound cleansers, or similar in or near your wound. This applies to both during and after using amicapsol, all the way through to stable wound closure. Also, never combine amicapsol with any product containing an antimicrobial or surfactant or with any other treatment approaches. Allergy to the tape adhesive used when dressing the wound can completely stop the healing for several weeks, so please check your skin every day along the tape line. Please check for any redness, such as red spots, red lines, blisters, and patches resembling burns, as well as clusters of multiple microscopic wounds cracking the skin. If you identify signs of allergy, please immediately change the type of tape you use or stop using tape altogether. If not acted upon quickly, an allergy can stop the healing of the wound itself. When your wound is free of infection, with no more discharge coming from the wound and no more pain or smell, you can discontinue the application of amicapsol. However, you should continue to follow the guidelines all through to full wound closure. If you have a condition that affects your immune system, the removal of the infection usually continues through to full closure. Therefore, amicapsol should be used daily until full wound closure. Examples include people with spinal cord injury, cancer, diabetes, multiple sclerosis, HIV, and on immunosuppressant medication. Please continue and watch the second of the 2 videos explaining the ongoing treatment of wounds with Amicapsule until closure.